Good morning, good afternoon, good evening. Warm welcome for this interesting webinar that we have on Joint Learning Networks Digital Health Companion. It's an AI-enabled inventory of resources co-developed by the policymakers and the implementers who are part of the Joining Learning Network. In fact, JLN has a long-standing association with AeHIN for a very long time that we have been actually part of each other's event, participating. And for this webinar, I have the pleasure of introducing the speakers. And I would like to introduce Marelize, who probably doesn't need an introduction, but nevertheless, I will do. She is the lead for digital and AI for human capital at the World Bank. And we have Mahlet, who is part of the Joining Learning Network team. She's a health specialist at the World Bank. And then also Dr. Siti Nurbaya. She is the Chief Assistant Senior Director, Family Health Development Division at the Ministry of Health, Malaysia. And we also have Mr. Mahesh Dinkar Nayak. He's the Technical Facilitator at the World Bank. And this is the JLN team that will be presenting to us today. And I would like to now hand over the floor to Marelize for the opening remarks and then also the flow of how this webinar will happen. Over to you, Marelize. Thank you.
Ganesh, thank you so much. And good morning, good afternoon, good evening, everyone. What a pleasure to be here at the AeHIN Hour to be able to share with you about this important work that's been done under the Digital Health Companion. I want you to look back and to think about a situation when you were desperately looking for some information, either a terms of reference or an explanation of what interoperability might mean, or when you first learned about HL7 fire and we all had to Google and understand what that meant. When these developments take place, it can be stressful and time-consuming to find the right information. Imagine you had an assistant that knew the content of every credible resource about digital health, that didn't require you to worry about, am I getting information from the right place? And an assistant that had a photographic memory of every page of every document and could instantly find those pages. That is what the Digital Health Companion is. And we hope to share with you today about this new free resource that's available for everyone to use. JLN member countries, AeHIN members, other countries, anybody can use this new free resource that is available. The development of this resource would not have been possible without many people coming together. Most importantly, the countries in the JLN network who all agreed that this was an important priority. And Mahlet and Dr. Nurbaya will share with you more about how the developments took place, as well as the countries that have been involved in their development, and the process by which we ensured that only validated resources are included in this resource library, the instantly searchable resource library that is very different to any other knowledge portal because it doesn't have endless lists of PDF links to PDF files or documents, but rather the ability to search, query, and even ask questions, even develop teaching curricula and all kinds of materials that could be useful. I want to give a special word of thanks in my opening remarks to Mr. Ganesh and the AeHIN network, who's been partners not just for the JLN, but particularly for this digital health companion. Resources from the AeHIN webinars where presenters of past webinars have agreed for the resources to be made available under the companion is in fact included. So imagine having access to all the webinars in AeHIN for all the speakers who have agreed, where one doesn't need to listen to every webinar from start to finish because one just wants to get the answer to one specific question. Also want to thank my colleagues in the World Bank, Mahesh, Mahlet, Somil, who have been instrumental in helping to make this happen, as well as the JLN Network Secretariat, who will be the long-term custodians of this companion. As you can see, this is a tool that took many voices coming together under the leadership of countries. I see, obviously, we have Dr. Nurbaya. I see Dr. Leke Ojewale from Nigeria and other country representatives. I see Dr. Muhammad is here. And so thank you to all the country authors who have been steering this process from the get-go. In the session today, we will first hear from Mahlet about the JLN, what it is, and what the Digital Health Collaborative is all about. Then Dr. Nurbaya will share with you about the Digital Health Companion, and we will also see a demonstration by my colleague Mahesh, who will show you how the companion works and just give you a small flavor of the possibilities that is available under this tool. In closing, let me just say that we welcome any and all feedback on this tool. The World Bank has played a supportive and technical assistance role in the creation of this tool, but this tool will now be maintained by the JLN network. And so any inputs, any advice, any suggestions to improve the tool even further is absolutely welcome. In this era of AI, constant changes and the concept of a living document is no longer a pipe dream, but something that we see unfolding in the era of hyper-personalization of information. And this tool is helping us to do that. With that, Mahlet, over to you.
Thank you. Thank you very much for those remarks, Marelize. As Marelize mentioned, I will provide a brief overview of the Joint Learning Network and the Digital Health Collaborative, just to give you a sense of the collaborative as it stands now, the Joint Learning Network as it stands now. This network is a country-driven and country-led network. We currently have a membership of about 40 countries that come from across the world that come together, identify areas where they would like to learn from each other on their journeys to universal healthcare coverage, and identify pragmatic, practical solutions and their implementation practices. As it stands right now, the Joint Learning Network is a truly country-led network. We are led by a steering group made up of representatives that are elected by members of the Joint Learning Network itself, and we truly rely on our member countries on letting us know what are their pain points in their day-to-day implementation practices, and work with them to identify these pragmatic solutions and their challenges. Just to give you a sense of the learning approach that we take within the Joint Learning Network, we have what we call a collaborative learning approach. In this approach, we have policymakers and practitioners come together to co-develop global knowledge. They first start with identifying the problems and pain points of their day-to-day implementation practices. And then they, through learning with their peers from other countries in the presence of technical experts in the room, they identify some pragmatic solutions for their contexts, and then they synthesize and document that into a knowledge product, and then that's then followed by adaptation and implementation of these knowledge products to their respective country contexts, and then dissemination through public availability of these knowledge products on the JLN website. What we see today in the Digital Health Companion is the co-developed knowledge product through this process that was done by the Digital Health Collaborative members within the Joint Learning Network. To give you just a flavor of the different offerings the Joint Learning Network has, we have what we call collaboratives. Collaboratives are long-term learning engagements that last up to 2 years, if not more. We also have shorter-term learning exchanges, demand-based country pairings, which are bilateral or trilateral learning opportunities for our country representatives, and one-off ad hoc webinars. Through each of these, we rely on our country practitioners to let us know the priority areas for the learning activities, followed by facilitation of the activities with technical experts who elicit additional information from the country representatives. And then that is then followed by, of course, co-development of the knowledge products and the adaptation and implementation in their respective countries. On the bottom panel of this slide here, we have a QR code where you can access the long list of knowledge products that we have developed as a part of the Joint Learning Network so far. Just to give you a sense of the different areas the Joint Learning Network has worked on so far, we have this slide here. I will not spend too much time on it as we are going to be focusing on the Digital Health Collaborative, but we have currently active learning collaboratives in health financing, provider payments, service delivery and quality, and other areas, including climate smart health systems. If you would like to learn more about any of these, you're welcome to access our website or reach out to our team. And now diving deeper into the Digital Health Collaborative itself, the Digital Health Collaborative has membership from about 15 member countries, and we do have one observer country. This collaborative came together with the objective of learning from one another about what work to integrate digital technology and data into healthcare system. And resources for this collaborative are provided by the World Bank, the Japan government, and the Gates Foundation. And technical facilitation is led by the World Bank team in close collaboration with the Digital Health Exemplars team. And the countries that you see listed on the bottom panel have been engaging since November of 2023 in identifying different areas within digital health that they would like to work together on. And I'll go over these just now, just to give you a sense of the journey that Digital Health Collaborative has come through. In November of 2023, members, country representatives from these 15 countries came together to identify, debate, and prioritize 5 key areas that they would like to focus on for learning for the 2 years of the collaborative. And through that process, they identified an AI-enabled inventory of resources, interoperability, governance, private sector solutions, and a dialogue toolkit for making the case for digital health as the 5 key areas that they would like to work on over the 2 years of the collaborative. What we are here for today is, of course, that AI-enabled inventory of resources. And since then, participants and country representatives have engaged in different virtual and in-person engagements where they had in-depth conversations and discussions about what to include in each of these knowledge products, particularly for the first 3. And most recently, in December, they had an in-person engagement in Nairobi where the drafts of the knowledge products for the first 3, so this is on the inventory of resources, interoperability, and governance, was reviewed in depth with these country representatives from the 15 member countries in the presence of some of our regional network representatives, including AeHIN, Rekain, and Helena. And then we are now in the stage of finalizing some of these first initial knowledge products and going into the co-development process for the knowledge products on private sector solutions and the dialogue toolkit on making the case for digital health. With that said, I will not take too much time. I'd like to introduce our champion, our fierce leader, Dr. Nurbaya, who has been really engaged in the co-development of the Digital Health Companion itself among the other work streams. Dr. Nurbaya is the Chief Assistant Senior Director in the Family Health Development Division of the Ministry of Health, Malaysia. With that said, Dr. Nurbaya, over to you.
Thank you, Mahlet. Good evening, everyone. Thank you for giving me the opportunity to present this digital health companion, representing my other colleagues, JLM member countries from the digital health collaborative. There are many interesting, like what Marelize have presented, that there are many interesting resources in digital health, and it is truthfully we do not have time to go through in depth each and every one of the resources. And actually, for practical purposes, we need certain parts of the resources for us to use in our day-to-day life. So we are often we need some specific information for us to use. So so we don't but we also want the information to be trustworthy and correct. So that is why we need AI to help us find this reliable information easier and faster from a large volume of resource within digital health. So that is why this companion is very much needed. So several of us in the Joint Learning Network collaborative came together to answer this question, which is several countries highlighted the need for using technology to make it easier for policymakers working in digital health to get information they need. In response to this need, all the authors, several authors, including me, began working on an online AI-enabled chatbot assistant to provide answers using only trust and verified digital health resource. So of course, there are other chatbots that we can use, but we want it to be of a reliable resource. So we worked over 9 months to design and develop an AI assistant, the Digital Health Companion that now we know as Digital Health Companion, DHC. So in phase 1, we validated the need for the DHC in June 2024. In phase 2, we developed the technical and content scope in August 2024. In phase 3, we developed a prototype in October 2024. Then we conducted pilot testing of the prototype and got feedback in December 2024. From the feedback, now we have launched the product for use, the Digital Health Companion, and this month, March 2025. So the Digital Health Companion has some exciting features. So it is a virtual assistant powered using large language models that has read and memorized a vast array of vetted digital health documents and can provide instant answers to your questions. It's really very helpful. It is interactive and dynamic. The DHC offers an engaging way to explore digital health resource, making it simple to find information you need. It has multi-language support. I'm very excited about this feature. So the Digital Health Companion is available in multiple languages to serve a diverse audience. Like my country, we need a multiple language for Malaysia, and we have free. It is free. This is also one exciting feature. Free for anyone to use. The Digital Health Companion is open and free for anyone to use, not only JLN members. And it's also for many levels of knowledge. So, and the custom answers for your specific questions. The DHC provides tailored information to meet the unique needs for each user. So it can go to the very hard or simple levels of knowledge. In other words, an endlessly patient assistant awake 24 hours that has memorized every page of every document and who that can answer questions in any language and whose response you can trust. So the Digital Health Companion covers information on multiple areas in digital health, interoperability, digital health governance, health informatics, cybersecurity, digital health finance, procurement, AI and health, maturity toolkits, EMR, digital health strategies, and data standards. Okay, this is an example of Digital Health Companion in action. So you can type in, explain medical coding to me in 2 paragraphs. So in a few seconds, it will come out your request. So this is one example, and it will also give you the resource of where the information is from. Like for here is number 2 is put in number 3, 1 and 3. So this is the QR code that we can now access the digital health companion. So the key ask from all of you, please use the digital health companion. We will give the links, and please feel free to share feedback with us, because of course we want to continue to improve it, to make sure it is very useful to all levels of users of this companion. And you can also recommend additional resource that could be added to the digital health companion. So let me play a video to introduce you to how the companion works.
Thank you, Dr. Nurbaya. I will now display the video where Mahesh provides a demo of the Digital Health Companion.
Welcome to this short guide on using the Joint Learning Network Digital Health Companion. Think of this tool as a virtual assistant that has memorized a lot of information on digital health policies and programs and is here to help you 24/7. In this video, we will walk you through how to provide prompts or ask questions to the tool and generate responses. The first step in the process is to click on the link that has been shared with you that will help you get to this landing page that can help you interact with the digital health companion. The second step in the process is to enter your prompt or question in the box that has been highlighted here. I've asked the companion a question around explain medical coding to me. You can ask more detailed questions to the companion. Here are 3 tips to keep in mind. The first is to be specific. The more details you provide, the more relevant the response. Related to this, it's important to add relevant context to the question. This could be linked to a country for which you're looking for information on. The third is to iterate and refine. If the response you get isn't quite right, tweak your question so that you can get better responses. After you've added the question, simply click on the arrow button here to send your prompt and receive a response from the companion. After a few seconds, I receive a response to my question, which appears above where I typed my original question to the digital health companion. In the response, you'll notice cited numbers within different parts. These numbers link to the original resources the companion used to generate the answer. You can click on these numbers to access the original sources, which may be in the form of a web page, a document, or a video. You can continue interacting with the digital health companion by asking more questions. You can ask follow-up questions related to the original question you asked and the response you received. Or you can also start a new chat or interaction with the companion on a different topic. To do so, click on the new chat icon highlighted here. Thank you. This brings us to the end of this short video guide. We hope you use the companion, and please let us know if you have any feedback.
Huge thanks to Dr. Nurbaya and to Mahesh, who provided this demo for us. Now I would like to invite Ganesh maybe to provide some comments on the Digital Health Companion and its implications for AeHIN as a key collaborator on the process of digital health, the development of the Digital Health Companion. Ganesh, over to you.
Thank you, Mahlet. At the outset, I would say that it's a very helpful tool. AeHIN with presence in over 84 countries right now with 2,400 plus members. And then we do have representations, what we call as the AeHIN Working Council from 14 countries right now. So I would say that most of them also are working with the Ministries of Health. And then also we do have representations from academy, professional societies, NGOs. I think this is a very helpful tool, especially since the source is curated, because there is a difference between searching on Google and then like also searching in a tool that is specific for the occasion, and then also where the source is, the data is curated. For example, like we can search for, say, a national digital health strategy of a country, possibly when we search in Google, maybe there will be multiple versions of the same. There could be draft version, it could be an old version, and then which may not actually be the reflective of the current status. But then in this tool, since there is a process of curation that goes on for the background data in which it is searched, these are taken care. And then also I like where you also have how you can actually customize. Like, for example, if a particular response is not very kind of suiting what your expectation is, like, of course, like any tool for that matter, like it depends on how much we use, how much we also contribute to the data also, and then how we actually help the learning of the particular tool. And then another occasion that I think was also stressed by Dr. Nurbaya is actually the multilingual capability. I think that's very important because most of the times that, we search in English and then like that's what the responses that we get. But this tool actually is very helpful in getting the responses in other language. I can share like one of the convergence workshops that we recently conducted. The entire workshop was conducted in the local language. So that also shows that except than the speakers, that few of us, everything was in the local language. And then we ourselves had to listen to the entire proceedings over 2 days, translated simultaneously. So this is a tool that, that has this capacity in or capability in another language. I think that's a fantastic support that members will have. And then also looking at the various scenarios, like various people, depending on, I would say, like a persona, a policymaker or an implementer or a researcher or a student, like everyone will actually be looking at it in a different point of view. So I think the tool actually in my understanding, like it also learns over a period of time. That's what typically happens. And then also, since it is a free tool, it's available for the community. And then it's also our responsibility as a community to contribute back to that. Because as good as that, how much we contribute, and then like we also get the best out of it. So possibly with that, like, a broad, I would say that overview. I will probably see if there are any specific questions from the audience, and then also put this thought, like how this community, because this is a tool, as I understand, like, right, it is developed for the community, for us to use. So now how do we actually contribute for this to become better? Like we do, we also saw the areas, like the broad areas, currently it is available, right? And then, there are in digital health, there are every day there are so many hundreds of resources being added. So it's not that like, something that was added yesterday would likely to be there right now, but because, this is a process of curation, there may be some steps of ensuring quality, somebody looks at it, and then the resources are also get added to the pool. So that's the process. So how do we actually contribute? Like, and then also, before I throw open this question of how we can contribute, what is the feedback from the AeHIN members who have joined here? I will also ask Marelize, like, what do you think some of the use cases, Marelize, like, how do you think that how going further, how is that this community could possibly contribute? Broad areas, and then over to the audience here. Thank you.
Thanks very much, Ganesh, for that question. And I've also begun to answer some of the questions in the chat if anyone wanted to follow along on that conversation. I would say two things. Jay, first of all, I think that the community can use these resources to hopefully further digital health in their own countries, right? One can use the resource to help develop a draft terms of reference. One can also use it, for example, one can use it in teaching mode to say, teach me about the following, right? We've used it to say, we want to develop a one-day course on interoperability. Help me think through what should be the curriculum and content and where can I get some of the materials from, right? So it's really useful for that purpose. Now, we know that this tool is only as good as the data in it, right? And so the process of both there are 3 ways in which the JLN community can contribute. Use it and tell us where there are weaknesses. Tell the JLN Secretariat where there are weaknesses so we can improve it. Help to expand the list of validated resources that are used. There's an operations manual that defines exactly how the continued addition of resources. There's a list of over 700 resources plus websites, etc., that we are drawing from at the moment, and we know that those are not all of them, but those are the validated ones, right? So we want to make sure that we are selective but not too selective, right, about which resources to use. If you can see a list of the resources, they're publicly available to anyone who wants to see which resources we are drawing from, and if you think there are ones that are missing, you could let Mahlet know or any member of the JLN, and we can always add resources in future, right? Then the second way in which the JLN, the AeHIN community can contribute is if you want to help us co-develop future revisions of this tool, right? For example, this video that Mahesh showed of the demonstration of how it works. That video is only available in English at the moment. We know we can use Bland AI or other tools to translate it, but we think it would be good and it would be useful if there are AeHIN members who are interested in maybe translating the video and doing a video in their own language for how the tool could be used. And then the third way is to help us and share with the JLN Secretariat how you are using the tool in the field. You know, I think we know that the tool is free and available to anyone to use, but we also know that it's really important that we are documenting how and whether the tool is useful, because that will help to ensure that funding and so on for maintaining a tool like this is always available. So those are the 3 ways. Use it and help us to improve it. Make a video if you want to do an in-country demonstration and want to share it with your digital health community in the country. And third is help us to co-develop and think about how we can document how the tool is useful, if it's useful, so we can keep using it in the future. I hope that helps to make it clear.
Thanks a lot, Marelize. One particular request here. We also mentioned about the process of reaching the JLN Secretariat, right? So may I request the Secretariat to also put in the contact information in the chat. So if anyone has any other clarifications, they can also reach out to you. And then, of course, if it is available already, the contact details are available in the DHC site, the portal. That's okay. But otherwise, also, if you could actually mention in the chat whom to reach out, that will be fantastic. And then maybe I think we will also look at the questions that has come up. I also see one question in the Q&A and then more on the chat. Shah, can you actually read out?
Yes, Sir Jai. We have a question in the Q&A. This is from Dr. Aminul. He's asking, does the DHC provide an image or diagram as content combined with textual information?
I think if I understand correct, Aminul, you are asking like it can actually give you give the output as an image as well, right? Like you probably you are talking similar to like how a ChatGPT generates the image. You mean that?
Thank you, Joy. Because I just wondering to ask you, like the diagram or something, you know, it comes with along with the text. Like in the ChatGPT, we have some tabular format or different, you know, form we can get the output. So it's only the text based or only the, you know, graphical content also with the text, mixture of the text. That was my question.
It does not provide graphical content, but because of the version of ChatGPT, the GPT that it's based on, the transformer model that it is based on, it can read graphical content if it is part of documents, but it will provide the output as text outputs. And the reason we did that is simply we have so little so little control over what that graphical output looks like. I think we know there are still some constraints with graphical outputs. I hope that answers the question.
Thank you very much.
Next question, please.
We have a question from Dr. Bunchay. If the team can show the architecture of the DHC.
We would be happy to, if anybody is interested in learning more about how the architecture work, because it is deployed on the JLN website at the moment. So if anyone is interested in those details, just reach out to jln@worldbank.org, and we'd be happy to set up a meeting to explain that to you, together with the JLN Secretariat, who's now housing, which is where the tool is housed, and they're using it on an ongoing basis. I think we'd want the team who is housing the tool to be part of that conversation. So we'd be happy to facilitate that if you just reach out to the email address provided in the chat.
Thank you, Marelize. Can we go back to the slide where we showed the existing topics or the areas? Maybe then we can ask the audience, like, is there any other area that they would like to see which may be missing in their perspective? So participants, like, if you could also say, like, come forward and then say, these are the multiple areas that the digital health companion covers. Is there any other that you think it is important that should be there? If anyone has, please raise, and then we can give that opportunity floor to you. Or you could also put down in the chat. That's also fine.
Hi, Marelize and the team, and thank you very much. I think the companion is good, and using it like the expansion of the foundation model that we are available. It is very available now, and I think the contribution that we can help as a community is that how we gonna increase the archive repositories of the that lacks. We'll read on that. I try test the companion. It's quite slow first. The second one is that I asked what is the digital health companion provided by JLN. There is no detail about the digital health companion. It only describes the JLN. And I think the good thing is that we already it has the reference that we can go back on that. To me, I think we can do more, not just giving the companion to the community, but we should kind of maybe provide some training on to keep up with the AI, especially right now it's multi-model AI, and also the lag. And to me, I think it's the next in the next few months, the agentic already be. For others, I now trying to use more the agentics, like to dig down more question using deep research by several company, ChatGPT and also DeepSeek, and it's very impressive. I think as a community, we should kind of first validate actually the digital health companion, that how much it kind of not hallucinate. And I think the way that we can do in the next step is to do the research to verify how well to measure up with the other tool. So we will be able to kind of rely on the content that we get. Over to you. Thank you.
Thank you, Dr. Bunchay. I think somebody has also already put in the chat what the DHC actually gave the answer as. So it's from Dr. Ahmed Hidayat. He has actually put, so Dr. Ahmed, like, this was generated by the DHC, right?
Yes, it's correct. I asked what's your AI capability.
Oh, thank you. Thank you. So one of the things that if I remember, like I think this was during the, I think November, end of November, and then we were discussing, we had some sessions thanks to the JLN team, which also arranged this for introducing the pilot testing tool. So one of the suggestions at the time also came up was a brief description right on the tools page itself, just a very brief, because like it's endless to have so many suggestions on so many topics, but just to have a brief couple of lines. Of course, it says it's a AI companion tool, right? But then like maybe like how we initially when this webinar began, like for whom it is meant for, what it is, that kind of a thing, like maybe like few lines that will also be very helpful. I think that came up. I remember that came up during those pilot discussions. Thank you. I see, Dr. Aminul, your hand. If there are any other questions on the chat also.
Joy, I was just wondering if it is possible to add digital health architecture in the building blocks, because it is important, as per my understanding.
Thank you, Aminul. Will you be able to also contribute resources related to that anyway as an AeHIN member?
Yes,
So,
I can contribute that.
okay, because
I'll be
whoever
happy
is
to.
suggesting topics, I think we also have the added responsibility of contributing something on that. So that way, like we tie your suggestion, your wish list gets in also with the resources. So both are tied. So
Okay, thank you, Jay.
yeah, sure. And then currently, like I think Marelize mentioned in the beginning itself, like maybe some of you may not have joined at the stage, like AeHIN webinars, like including this, right? So this particular one, like once we have the, the consent from the speakers, that actually gets into this tool. So that is one way that this community from AeHIN members are also contributing. Just to highlight what was said at the beginning of the webinar. So very soon this webinar like also will get in. And then anyway, consent will not be an issue here. Thank you. Any other thoughts and reflections?
If I can just maybe provide a response, I think Dr. Aminul's point about having digital health architecture as an explicit point is really important. At the moment, it's grouped under interoperability, since you need the architecture in order to get to interoperability. But so I think Dr. Aminul, both contributing resources, but also tagging those resources that are already in the companion that may be relevant to architecture, I think is really important. I do want to point out to what Dr. Bunchai was saying about agentic AI. There's also knowledge graph and RAG models that work together, right? When we initially conceptualized this tool, this was at the AeHIN meeting, last year in November, I should say 2023 in November, after the AeHIN meeting in Jakarta, where the JLN members got together for 2 more days after the AeHIN conference to decide what to do to improve the field of digital health. And at the time, RAG models just came out. I think one of the challenges with tools like this is that they're always going to be 1 or 2 steps maybe behind the most cutting edge work and technology. That just means that we have an opportunity to use these newer approaches to improve. I think it's important that we also consider that, yes, one of the challenges of RAG models, and it's one of the reasons why, sub-parsing it into knowledge graph-based approaches where you kind of sub-classify the entire corpus of knowledge, so to speak, improves the speed, right? Because we know RAG models, in having to go through that entire set of knowledge to find the right answers, does take a little bit of time, right? So I think at this stage, just be a little patient. The answer will come, but remember, it is searching. And to me, it's actually a good thing that it's a little slow, because it means it really is searching through everything. But, as we say, this tool that's why it's in an extended testing phase. As somebody asked, why is the word test still in the link to the tool? It is because we recognize that this is a very fast moving field. And every time we put a new version out there, it's already almost outdated because new technology has come into place. I think keep in mind we're the basis of the tool is to make it better than what is currently available, right? And that is that if one wants to find information that you are assured is the right information, it is hard to do so, because one has to make a judgment call as to the information. Is what I'm getting the latest, is what I'm getting the validated information from the WHO, country digital health strategies, and so on. And so I think the value that this tool adds is that it provides that validation, which is really, really important for this process.
Thank you, Marelize. Like, one of the things that you also said was also interesting, like to, for example, use this tool to create a training on interoperability, or, for example, governance. Like, I think it will be very helpful, the members who are attending right now, and then also those like who may not be able to join today because of other constraints, that you may be listening to the recording in a week from now. And then you could actually try out this tool and then get back, like, what is your experience? I think that will be fantastic. I think, looking at like each one may have their own use cases. Maybe somebody is looking at creating a TOR for the teams, and then like maybe somebody is writing a grant proposal, somebody is writing, maybe somebody is writing a thesis, like looking at the references, like, so like, we have a variety of use cases. So I think that will be a fantastic array of, use cases that, the community could look in and then get back. And again, to reiterate, like, as much as this tool is a community tool, as much as the community contributes back, I think that's where like we also benefit better. Use it, and then also find out what could be, and then the team is open, right? That's very, very, very important thing to know, that the team is open to actually know what could be improved. So that is something that, yeah, I would leave the floor if there are any other questions. If not, then we will conclude. Maybe with maybe 1 minute or 30-second remarks from the JLN team, and then any others. And then we will have a group picture, and then also we will have the announcement regarding the next webinar.
I'm going to hand the microphone to Mahlet. Mahlet, over to you.
Thank you, Marelize. I just want to say huge thank you to our country representatives, Dr. Nurbaya, Mohammed from Senegal, Dr. Leke, everyone who has been involved from the JLN collaborative side in really driving this forward. I would also like to thank our facilitators, Marelize and Mahesh, for shepherding us through this process on the JLN side. Huge thanks to Somil, who I see here, and I want to make sure I recognize his role in leading us through this process as well. Thank you, Marelize, Dr. Anthony Ofosu as well, who's been through working with us through all of the work streams and not just this one. And finally, of course, Ganesh, AeHIN, the team, and all the other networks as well who have been helping us through this process. We look forward to continuing to revise the Digital Health Companion and working with you in the next steps. And thank you all.
Thank you, Mahlet. I think we are just about to at the top of the hour. I think we are on time. And then, like, if there are no other reflections, then we will have a group picture.
Thank you, everyone.